Can you have ADHD and autism at the same time, and how do you know the difference? I'm Dr. Mark Bertin, a developmental pediatrician with over 20 years experience in this field. Today, I'll be answering the internet's biggest questions on ADHD and autism. What's the difference between ADHD and autism? ADHD and autism, at least from an academic point of view, are actually quite different. When someone has ADHD, the most useful way to understand it nowadays is that it really is a difference that affects a very wide-ranging skill set called executive function. So when there's social difficulties related to ADHD, that has to do with these skills that have to do with managing everyday life, things like distractibility and other symptoms like being overly talkative or having a hard time of keeping information in your head during a conversation. For autism, the easiest way to think about it is that social skills and social intuition tend to develop intuitively in children, and whether you have mild or severe autism, what's happening is on some level those social communication skills aren't developing intuitively. For someone with ADHD, their social intuition is basically intact, but they may not be showing it in real life. And for someone with autism, separate from whether they're impulsive or inattentive, they're having difficulties reading social situations. Can you have ADHD and autism at the same time? The short answer is yes, but it's actually a very important question for a couple of reasons in this field of child development. The first is if you're living with either ADHD or autism, it's really important to understand that other things tend to tag along with it. Supporting someone who has either of these conditions means looking to see if they have other developmental delays or learning disabilities or anxiety, and making sure none of these other supports are needed in life. And the second is, until relatively recently in the field, it was said you couldn't have ADHD and autism together, and now it's actually felt to be fairly common. What is AuDHD? AuDHD is a term that is used to describe people who are experiencing symptoms of both autism and ADHD, and it's being used more and more as a way of people finding some understanding of what's going on in their lives and maybe seeking information. Practically speaking, in my field, ADHD and autism are both considered separate diagnoses, and AuDHD is not really a clinical term yet. It's great to use as something that helps with communication and helps with understanding, but it is important to understand that if you're communicating with a professional, they might not be using this term yet. How do I know if I have ADHD or autism or both? It's actually a great question to ask if I have ADHD, autism, or both, because I think it confuses clinicians sometimes too. In real life, the symptoms of both can be kind of muddy and overlap a lot, and the simplest way to sort it out is to go back to the actual criteria that lead to a diagnosis and try to separate those some. The criteria for ADHD at present really have to do with a challenge with a wide-ranging skill set called executive function, which are like your life management skills, but nothing in the ADHD diagnosis has to do with our social and communication skills and intuition. And for autism, the symptoms have to do with social intuition and communication skills, but don't inherently have to do with executive function. So from an academic point of view, or to sort out if you have symptoms of one or the other or both, the simplest way to separate it out is to look for either executive function symptoms or symptoms of communication and social differences, and then try to sort out, as is often common, whether you're dealing with some of both. And if all of that seems complicated or confusing, sometimes the simplest thing to do is find someone you're comfortable collaborating with professionally and sort it out with them. Does AuDHD look different in girls and women? AuDHD definitely looks different in girls and women. The symptoms in girls and women tend to be a little subtler and more internal, with fewer of the behavioral issues. It's also felt that some of the really intense interests that can be disruptive in autism for girls and women can be more typical of peers, although still maybe intense to the point they're disruptive. And girls and women sometimes are doing a different level job in terms of masking and fitting in, so sometimes the diagnosis can be completely missed. How common is it to have ADHD and autism together? It's actually very common to have ADHD and autism together, although it's not the same in both directions. Children with autism or adults with autism, the rate of ADHD is about 50% at least. Some studies say more. And for people with ADHD, about 15% of people with ADHD are felt to have symptoms of autism. So it is pretty common to have both together, and it is important to keep an eye out for this because symptoms of ADHD can exacerbate symptoms of autism and vice versa. By the way, does any of this sound familiar to you? Let us know in the comments below. Should AuDHD be treated differently than ADHD alone? It's actually quite important to treat AuDHD different than ADHD alone, although you often do want to start or at least emphasize treating ADHD. Since ADHD affects all of these life management skills that we call executive function, it can actually exacerbate just about anything else going on. So we want to get a handle on ADHD for sure. However, when someone has autism, they're going to benefit from more specific interventions that help develop social skills and communication skills, like speech language therapy or various types of behavioral therapy. And that's going to be a much more direct influence on their social development. Can ADHD medication help with autism? There are no medical treatments for autism right now, but when you have ADHD kind of exacerbates anything else going on in life potentially. So when you're trying to develop social skills with autism, if your executive function is off, you're going to have a much harder time showing what you know. One of the best one-line descriptions of ADHD is it's not a disorder of not knowing what to do, it's a disorder of not doing what you know. So if you're able to treat ADHD successfully, potentially with ADHD medications, and therefore your ADHD symptoms improve, that may lead you to show an improvement in the symptoms of social challenge that are going on with autism. What are common masking behaviors for people with autism and ADHD? Masking behaviors are an important thing to look out for with both ADHD and autism because everybody wants to fit in and show that they're feeling on top of things and successful in life. And with either autism or ADHD, this can lead to behaviors like really almost pretending to be on top of things at work without asking for help or being exhausted and overwhelmed and not reaching out to people around you. In the end, the more important thing to keep an eye out for is that this often leads to a sense of exhaustion or burnout or not being authentic to yourself. The bottom line to be looking out for when it comes to that feeling of masking or not being true to yourself is really checking in and making sure that you're feeling a sense of well-being and not overwhelmed in life. Why was I missed or misdiagnosed as a kid? This can be a very emotional question and a very difficult one to sort through. Professionally, in my field, I think that I've come up with 3 ways that I sometimes look at it. Most often, if things are misdiagnosed or missed entirely, it really does have to do with severity of symptoms, so that milder symptoms sometimes take a longer time to reveal themselves as the demands of life get more intense. The second reason is that as children develop over time, things do change. And what may look like one thing when children are younger can look very different as they're older for reasons we don't even fully understand sometimes. And then the third reason, depending on your age, that can be really confusing is actually the criteria for diagnosis change in the field, so that if you were evaluated at one age and then they've discovered new things about ADHD or autism as you age, that might change the criteria for diagnosis also. What is AuDHD burnout? It's an interesting term to use because I think burnout is a much broader topic than just specific to ADHD. But when it comes to people who have both autism and ADHD, like anyone dealing with any ongoing challenge in life, we need to be careful that we're taking care of ourselves and handling things enough to sort of sustain the resilience that lets us manage the situation as a whole. With ADHD symptoms in particular, those are your life management skills. And if you're chronically struggling to keep up with everything in life, that can totally lead to a sense of exhaustion and overwhelm that then makes it harder to handle everything in kind of like a vicious cycle. And when it comes to autism, one of the most important parts of resilience in life is sustaining social relationships and connection. So when you're struggling to sustain connection with the people around you and to make friends, that also is going to erode your resilience. But in the end, my hope would be that if you're able to reach out to the people around you and find the professional supports you need, you'll develop a tool set that'll help you manage any sense of burnout when it does arise. Is it okay to diagnose myself as AuDHD? The short answer is no one should be diagnosing themselves with anything in life, but I do think it's great to seek out information, seek out understanding, really just with an open mind go out and find the information you need to try to sort out, how you're living and what might be affecting you. However, diagnosis of either of these conditions can be really, really challenging, really confusing, requires seeking out very strict criteria. So the actual diagnosis should typically be made with a professional. What I really wish is that these sorts of resources were much easier for people to find. I wish everybody had access to specialists. The hope is that you can take the information that you find online, bring it to your pediatrician or internist, and together come up with a diagnosis if that's appropriate. And that helps guide you towards the steps you need to take and the resources you need to find to thrive. Have a question that we didn't cover? Try asking the Understood Assistant, a free chat tool on understood.org. It'll give you those quick answers you're looking for and customized tips based on expert-vetted resources. Thanks for watching, and make sure to subscribe to our channel for more content like this.